Hello everyone, I am Dr. Kona Lakshmi, Minimal Access and Bariatric Surgeon at Yashoda Hospital, Somajiguda. Today on eve of World Obesity Day, I would like to clear some of the myths and facts which are linked to the important management of morbid obesity, that's bariatric surgery. When we suggest bariatric surgery to a lot of obese people who are almost burdened by the weight and the medical problems associated with it, but still they take a back step when we say there is a surgical management for it, because in the general population there is a lot of misconceptions regarding this surgery, that this surgery will kill the patients, or the person will not be able to eat well after the surgery and they will be having persistent vomitings, or the skin will become very loose, and then they will not be able to do their active work and maintain an active lifestyle. And in lady patients, whether they will be able to conceive and take care of their families. So these are certain questions which always pop up, and there's a lot of negative thinking regarding this surgery. But I would say that practicing this surgery since the past 15 years, I would say that this is one of the safest way to lose a significant amount of weight. And being a surgery, it carries a risk of around less than 1%, which is equal to an obese patient undergoing any other surgery, maybe like a hernia surgery or a spine surgery or a gallbladder surgery or a hysterectomy surgery. And the risk is significantly lesser than an obese patient has to undergo a cardiac surgery or a joint replacement surgery. So I would say that this risk being very less and it giving a significant decrease in the existing body weight and also improving the comorbidities makes the person again regain back the health which they were losing because of their weight. But coming to the myths that a person will not be able to eat. A person will not be able to eat huge quantities of food which they were eating earlier, which has led to their weight gain. But the person will be able to eat the required number of calories what the person is supposed to eat per day, and we also train them to eat a more nutritious diet. So it is in true that the person will be able to eat a more good quality food and also a healthy diet, because our dietitian team will be looking after the person and training him to eat a healthy diet. And coming to the second myth that they will be vomiting persistently, that excessive vomiting will happen if the person is not understanding that they should not overeat. So if a person is trying to overeat, then only they vomit. So but because we train the person to eating smaller quantities of food, and also because of the surgery, the huge voracious appetite which the person was having prior to the surgery decreases significantly. So the person feels happy and satiated with the smaller quantity of food they are eating. So the question of persistent vomiting happening in each and every person undergoing the surgery doesn't exist, and it's a wrong myth. And then one more myth is that the person may die after the surgery. That is a very wrong concept. As we said, the risks are less than 1%, and a person dying due to bariatric surgery is significantly very less, maybe 0.1 or 0.2%. And usually these type of fatalities may happen if the person comes to us already very sick, morbidly obese, with bad heart, bad lungs, bad sugars. Now these people always carry a death risk with them because of their comorbid conditions. So when we are operating on this person for any reason, not only bariatric surgery but for any surgical process, they come under the high risk category, and there is a small chance that this person may die in the post-op or during the surgical treatment just because of their bad health condition and not due to the surgery. Because nowadays the surgical techniques are very good, very refined, very good anesthesia and supportive services, that we just losing a patient because due to surgery is very remote. And then coming to the lady patients, that they will not be able to conceive, or they will not be go through their pregnancies. The reverse is true. When the lady is obese, they have a high chance of having infertility, but once they lose weight, their fertility improves, lot of ladies fighting fertility and obesity. Once they undergo bariatric surgery and lose weight, they spontaneously conceive, and their pregnancy is more safer and more happier with less weight than in being obese and having obesity problems. So my request to all people and to the general society is, forget all the bad ideas about the surgical process, and if there is any person who is suffering or who you see is suffering from his or her obesity, please encourage them to use the surgical procedure, what is called the bariatric surgery. Thank you.